What are the tests we do? Just listen to your doctor. Go for every month test, examination and evaluation till 28 weeks of pregnancy. After that, it is going to be every 2 weeks you have to go for checkup, and in the 9th month, it is going to be once in a week checkup. First time when you go to meet a doctor, all the blood tests, which is antenatal profile, has to be done, and the viability scan is usually done around 6 weeks, 3 days, which will tell us how the baby is. Is it viable? Is it healthy or not? The next scan which we do is around 13 weeks of pregnancy, where we do an NT scan, which will pick up the major abnormalities of the baby and the cervical length and the chance of the mother getting any blood pressure in the pregnancy. Same time, we do a test called Penta marker test, which will pick up any genetic abnormalities, not everybody, but majority of genetic abnormalities which are common in pregnancy, and also the chance of getting hypertension in pregnancy. As we enter into the second trimester, you can actually have a relatively easier life. You can go out, you can do a travel, whatever you want to do at this time, and then eat healthy diet. That's what we look at, high protein diet. And then we have a TIFA scan in 5th month, that is Anomaly scan, where we pick up abnormality of the child. We check whether the baby has 2 eyes, 1 nose, 1 mouth, 5 fingers, and all those things. And the same time, after 2 weeks, we do a fetal echocardiogram, where the heart is also checked and ruled out any abnormalities. Then comes when we enter into the 3rd trimester, that is the beginning of the 3rd trimester, we start repeating a certain blood tests again, including the blood sugars, which is very important for us to know at this time if she is going to develop a diabetes in pregnancy. The same time, we do a growth scan and the Dopplers again, which will predict whether she is going to develop hypertension in pregnancy. From then, it is going to be 2-week checkup and the Tdap vaccine, as I explained before. From here, we look at the height of the uterus, the growth of the uterus, and any IUGR, growth retardation, which is happening. We look at where the placenta is it going to be in the way of the baby coming out or what? And from this 3rd trimester, try to avoid intercourse and again restrict the journeys so that you don't end up having a preterm labor. So till 36 weeks, it's going to be once in 2 weeks checkup, checking up the weight, blood pressure, and the routine growth of the child. Once you enter into 9th month, it's going to be a weekly checkup to predict if everything is going on well, and 38 weeks is the internal examination, where examination is done to check whether the passenger, the baby, and the passage, the way through which the baby comes out, are this thing for each other. So if everything is fine, placenta is not in the way, and the baby is with the head, and the pelvis is good enough for that baby, mother is left alone before inducing after 39 full weeks. If 39 weeks are completed, that is 9 months is over and 10th month is entering, that is when we, if necessary, we induce. She is not set into labor, we induce her for labor and try to do a vaginal delivery. Then comes the delivery, where we look at whether if the way is not good or placenta is in between, any other problem which can be a riskier for the mother is there, that's when elective caesarean is done. Otherwise, induction is done, where mother is allowed to set into labor. So delivery of the progress of the labor is done with proper monitoring, and if everything is good, delivery is divided into 2 things. One is vaginal delivery or a caesarean abdominal delivery. So don't get worried, get yourself checked properly every trimester with your doctor. Listen to your doctor, take your diet properly. High protein diet is important. From your side, you should be looking at fetal movement count, fetal quick count, with what we talk from the 3rd trimester, and keep a note about how the baby is moving, and discuss every question with your doctor. Yes, yoga can be done. Usually we try to avoid in the 1st trimester, and exercises antenatally and postnatally or the yoga can be started at 13 weeks of pregnancy.